Hello, everyone. My name is Yvette Cozier. I'm the Associate Dean for Diversity, Equity, Inclusion, and Justice at Boston University School of Public Health. Thank you for joining us for our latest public health conversation starter. Today's conversation is part of our SPH Reads series. SPH Reads is a school-wide reading program hosted by the Office of Diversity, Equity, Inclusion, and Justice. It aims to encourage critical thought and discussion among all members of the BUSPH community and is centered on a carefully chosen, thought-provoking book. The selection for the fall 2024, spring 2025 academic year is Strangers in Their Own Land, Anger and Mourning on the American Right by Arlie Russell Hochschild. In conjunction with this year's book selection, I am having discussions with leaders on themes of political divides, class, and race. Today, I have the privilege of speaking with Sara Minkara. Ms. Minkara served as the Special Advisor on International Disability Rights in the U.S. Department of State during the Biden administration. She has led global initiatives to mainstream disability policy, has advocated for disability rights at many global forums representing the United States, and has connected government experts with international interlocutors, providing guidance in many areas, including labor rights and independent living. Ms. Minkara is the founder of the DARK methodology, has delivered over 100 keynote speaker addresses at global forums, and led the inaugural G7 Inclusion and Disability Ministerial. Thank you so much for being with us today, Ms. Minkara.
Thank you, Yvette, for having me, and I'm excited for this conversation.
Wonderful. To start, in your work during the Biden administration, what were the most vital strides taken towards improving disability policy and disability rights within the United States and internationally?
It's a really good question. And if I take a step back, in terms of like illustrating what are the gaps, and then we can talk about like kind of what are the strides we made. The disability community at large, the 1.3 billion individuals in this world with a disability, the 16% of the world population, we're very much either an invisible population, we're not even seen. But if we are seen and brought to the table, we're only brought to the table from a social protection lens, right? Let's take care of them. Let's provide their social services, and it will stop there. But most global spaces, most policies, foreign policies, we're not bringing in the disability community from a point of value, from a point of like, we are contributors to the economic conversation. We need to be at the security conversations. We need to be talking about disability and trade. We need to talk about disability and digital transformation. So very much we're not part of most of those spaces. So when I started in my role, we intentionally said disability inclusion is not just a human rights issue, and it is a human rights issue. That is the baseline, but it is also an economic security and so much more, right? So we started just looking and targeting at spaces where we're not being brought forward, and how do we bring them forward? So we focus a lot on G7, on the Asia Pacific Economic Cooperation, on the ASEAN, US ASEAN. We launched the first ever US ASEAN high-level dialogue on disability. Getting the C5, the Central Asian countries in the US, and the C5+1 to have disability is one of the priorities. So we were looking at spaces where disability is not really discussed or thought of and bringing it forward. But we still need to make sure we're not just talking to each other as a disability community. We need to make sure we're not just looking at it from a social protection lens, and we need to make sure we're inserting ourselves in spaces that we're not thought of.
Great, thank you. So disability is not a partisan issue, at least it shouldn't be.
Yeah.
Why do disability rights and policy seem to split down partisan lines?
It's not a partisan issue, and on all sides, people do, do care about disability to some degree. But again, I would go back to this point where a double-edged sword. No one, if you come up to a person and say, hey, let's work on disability inclusion, no one will say no, right? They will be seen as a jerk if they say no, right? Everyone will agree on that. But on the other hand, we're not seeing what a society does not see the value in bringing us forward in a lot of these spaces. Society does not understand the barriers that we face in terms of being brought forward, that exist, preventing us from being brought forward to these spaces. Society still sees us as special needs, or a different population or an add-on population. Society is still seeing us from a very much a different lens. And I think that in itself, that narrative prevents individuals, prevents spaces and systems to bring us forward from an intentional lens.
Yeah, yeah. So, looking forward, or actually looking in the present time, with the current political divides and the new administration, do you think this will bring setbacks to the work that has been done for disability policy and disability rights?
Yeah, I mean, it's a couple things. One, people keep saying DEI, right? Eliminating DEI. Well, diversity, equity, inclusion, well, it's DEIA, right? Diversity, equity, inclusion, and accessibility. That in itself illustrates that we're always dropped out of that conversation. A is not even in a lot of the discussion points. But on the other hand, we're still impacted by these policies that are being put forward, right? We're still being impacted either way. So we're not seen on either front. And I think that's the harmful thing, is that how do we really ensure that the disability community is at the table, and how do we make sure that we're bringing that voice forward? So yes, what's happening is impacting our work. What's happening is impacting the disability community, both internationally and domestically. And we need to really ensure that the voices are at the table. But I've also talked to advocates and activists on this issue, mainstream advocates and activists, and say, please make sure you are breaking down barriers so people with disabilities can be part of your coalitions and your movements, and being able to really bring their voices forward as well. It's not easy sometimes for us to even access basic tools for us to advocate and be part of these spaces, if that makes sense.
Yeah, yeah. Can you just say a little bit more about that? So what some of the barriers might be?
I mean, yeah, exactly. I mean, if we are, I'll give you a very simple example. Let's say me as a blind person and a group of us are meeting, virtually meeting together, and using one of the platforms. I'm not going to say which platform this is. Using one of the platforms that are not fully accessible for me to use with a screen or software, I'm not going to be able to access that meeting, right? I'm not going to be even able to really engage in that conversation. People don't think about those things. Or let's say there's a meeting at Congress, right? They're coming together, and one of the people that want to attend that meeting is deaf. And if there's no sign language interpreters, they're not going to be able to engage in those conversations. So there's a lot of different ways that we don't think and truly fully embrace the different barriers that the disability community might face on a daily basis, just in living their daily lives, and that will translate in then being able to bring their voices forward.
Thank you for that.
Yeah.
So just changing gears a little bit, can you please explain what the DARK methodology is and how you think these workshops can be particularly useful to organizations with our current political divides?
Yeah. So the in the dark methodology really stems from the space of how do you create a space where people can bring their authentic self forward. And the way we do it, has nothing to do with simulation of blindness. I'm against that. But what it is that we blindfold people before they enter the room. We tell them you cannot say your name, where you're from, what work and educational background, because those are 4 things that we tend to anchor ourselves in, right? We guide them into the room. We don't tell them anything about how the room looks like, who they're sitting with, how many people are in their groups. So there's that constraint of not seeing. There's a constraint of not knowing their surrounding. There's a constraint of not saying those 4 things. There's a constraint of not seeing body language and facial expression. And then we facilitate an hour and a half long conversation. And because of the setup, the structure, and those constraints, people become more open, more willing to share they're more willing to share their perspective, their voices, and more willing to bring their authentic self forward. And on the other hand, they're not able to box and label and bring a lot of assumptions. A lot, not all, again, a lot, because 85% of what you take in is visual. We do tend to box and label through hearing and through smell and that kind of stuff. But because we're limiting so many of those, the visual and the other constraints, that gives the freedom for people to really listen more intentionally, really get to know that person without a lot of assumptions, And it's so powerful. We've done it all over the world. We've done it for all kinds of sectors, and it's so important for nowadays because we're not hearing each other. We're not really connecting. We're not giving a space to have those difficult conversations, which we do need to have the difficult conversations. Humans are humans, and there's one common thing that we all share as humans all over the world is the desire to be seen, heard, and valued. And I think that's what the In the Dark methodology creates that space for those conversations.
Wow, that sounds incredible. And the feedback from past participants has been what I'm imagining just revelatory in terms of like how they feel. I mean, what is some of the feedback that you've received?
There's there's been feedback both on individual and organizational level, and especially on the individual level, people when they go through it, it's an experiential workshop, and it's a workshop where we don't no one's pointing fingers, right? It's a workshop where we talk about where we really understand how narratives impact us and how much do we embrace ourselves and how much do we bring our authentic voice forward. And it's also about how we create narratives. But people leave the session learning more about themselves, learning more about how what are parts of themselves and that they're not really bringing forward, being able to connect with their group mates in a deeper way. We've done it for team members who have known each other for a very long time, but this workshop really takes it to another level. People leave being able to, I mean, they sometimes people call it like therapy,
Mm.
but it's very transformational. And I hear years later people come up and say that was the most transformational workshop. And again, it's done because it's not pointing fingers, it's experiential, and everyone it kind of levels out the playing field in so many ways.
Oh, great, great. Thank you. Um, so pushing towards public health, how can practitioners in public health make sure to keep the work that has been done in this space moving forward?
So public health professionals, they play a huge, huge, huge role. And I think what's really important is that how do we ensure that the disability um, voice, the disability community are part of every single process within our within kind of our space, especially when it comes to research and data. And I think we don't have enough data when it comes to disaggregate data on disability. We don't have enough, and there's so much more work to be done, the intersection of disability and public health. And, we need to continue this work forward. And I think now more than ever. But again, bringing the disability community at the table. So not designing research, not designing thought leadership without the disability community being at the table.
Yes, and as public health practitioners, we often, intersect with
Yeah.
government and
Yeah.
other structural organizations. And how can we again keep this work moving forward and those fronts? Certainly with the changes that we're seeing coming from this new administration.
Are you talking about like ministers of health and health practitioners on that front, or?
I'd say kind of both, really, any of the larger places. So as public health
Yeah.
practitioners, how do we engage with here in Massachusetts with our legislation to make our legislators to make sure that the gains that have been achieved don't slip back?
Yeah.
What is the role that we can have in that?
I mean, it goes back to what I was saying. We need to bring so there's a phrase in the disability community, nothing about us without us, or nothing without us. So bringing disability civil society to any policy development, any legislation, drafting and kind of the feedback. But I don't have specific expertise on this. Like for
Mhm.
me, what's really important is bringing the disability civil society, who work in public health and are brought to the table to make sure that their voices are heard. Again, domestically, I'm not an expert. I mean, there is a concern, like there's huge concern from the disability community in terms of the cut of Medicaid and also within the Department of Education, that's more education related, Section 504. So there's a lot of different things that are being put forward that is going to hurt the disability community. For me, it's really important to understand the stories of the disability community and how these different policies might impact their lives, and how can public health practitioners really intentionally bring that voice forward. But I don't have more specific expertise on this.
Yeah, no, these are good things for us to be thinking of, and certainly each May, we graduate a new class of students. I know many of them would be very interested in this work, so your words are quite helpful in sort
And
of guiding that.
for any student, I always say, whether you're a student of public health, whatever student it is, it's really important that you will always, you need to engage with the disability community. And I think this is something that we've really worked closely with our US embassies all over the world. And sometimes these embassies have health attaches. But our message for our US embassies, and we developed a playbook, our message was that every single division, every single section within an embassy needs to have a disability lens, need to be integrated. And I'm not asking, I'm not asking a specific disability project. Sure,
Mhm.
there might be a need for disability specific initiatives project, but anything that we do, there should be a disability lens to it.
Yes. And thank you. And that actually rolls right into my final question, and that is the more broad advice that you have for our current students and soon-to-be graduates as they embark on their public health career. So in addition to being inclusive and having the disability lens present, what general advice would you give them?
Um, my first advice is that, um, you know, understand that we all have assumptions towards disability. And I'll give you an answer. I'll give you an example. I was in a country and we're meeting with this minister of health, and she was saying that, their healthcare practitioners, their community, their hospitals, their doctors, their nurses, they're really great. There's no stigma. There's no, they're doing such amazing work. And I said, that can't be true, because have you asked the disability community themselves what their experiences are, right? And for me, it's almost like it's really important for us not to have assumptions towards what the disability community's experiences are, but instead, how do you bring their voices forward so you can hear their own experiences and their own barriers? It's really important for us to really understand, how do we keep breaking down barriers, intentionally. And it's really important for us to really understand it will help our work in general when you bring the disability lens. It is a benefit for all. And I think that's, a basic thing that people don't think about, in the sense that when you make a system and policies accessible for the disability community needs, that will be a benefit for everyone. And let's be real, a lot of us as we age will gain more disability. We all have disability that touches us in different ways. It is part of our reality, but we always see it as something, we don't talk about it from a point of how do we really make a system that's accessible for everyone.
Well, thank you so much for these great words, and I think our students and our community will find them inspiring and a great guidance as they move forward. I want to thank you for joining us this afternoon, for sharing your time and your experience, and I wish you the best, and I hope that you'll come by and visit us again.
Thank you, Yvette. Thank you so much. It was great talking to you.
Yes, yes, thank you.